virtual open house for the master's, the MSN, Family Nurse Practitioner license, degree, excuse me. And we're just a little bit of agenda. If you guys weren't here, we're going to save the questions and answers to the end, but feel free to go ahead and ask your questions as we go along throughout the slides. We're going to meet our professors who are here today. We are thankful for them to be here today and excited to get some of your answers as well. Alrighty, let's go ahead and get started. Again, if you don't know how to use a chat here. Raise your hand if you have any questions at the end as well. Alrighty, so here's our professors, Dr. Cheryl Otijen. I'm sorry, I don't know.
Yeah, it's okay.
Thank you. And Caroline Stowe. Our two professors here at George Mason in our nursing department. Do you guys want to go ahead and take it away?
Sure. So Caroline, go ahead if you want. And yeah.
Sure. Hi, everybody. I'm Caroline Stowe. I'm excited to be here with you tonight. We're just going to run through these slides. You can see that Dr. O and I can kind of, and we say Dr. O because it's much easier than pronouncing her actual last name. So we always call her Dr. O. And right. So we are so thrilled to get to chat with you guys tonight. My pronouns are she, her, and you can call me Dr. Stowe. You can call me Caroline Stowe. It's very casual here. You can see that I actually got my doctorate here at George Mason. And so not only have I been a student here, but I've also been teaching here as well. So I think I bring different perspectives, just like Dr. O does. So super excited. So I'm going to move on to the next slide. We just want to run through kind of, what is the MOL program like here, at Mason, and kind of what sets us apart. There are lots and lots of programs out there. And what we really are excited about is that the kinds of nurse practitioners that we are producing are really, top notch. You're going to get a wonderful experience. We were just ranked as number 37 for the best master's program in nursing schools by US News and World Report. We have financial aid programs and lifetime access to Mason's career services. This is key because in school, the career services are important, right? They can help you with your resume. They can help you with so many different things, but it's that after part where you're really going to really get quality care and help in terms of career services. And even as after you graduate, you can access the jobs, people who can help you as you continue down your career path with updating your resume. Every one of our faculty has years and years of experience. So we don't have ones that are so ancient that they don't remember their names, right? And we don't have ones that are so young that haven't practiced at all. So we've really found that sweet spot of those who have worked long enough to really understand what they're doing and ready to pass that knowledge along. We really pride ourselves on, evidence-based nursing. So sorry, that is actually a 7-year-old trying to FaceTime in with us. And so again, real world experiences, right? We know all of y'all are busy. You have kids, you have jobs, you have things. And so we want to fit in with your current lifestyle, right? And so we are fully accredited, our MSN FNP program by the Commission on Collegiate Nursing Education. You'll hear CCNE a lot as we're going through accreditation again. And our curriculum was founded on the Interprofessional Education Collaborative Core Competencies. Dr. O, do you have anything else to add here?
Yeah, we have our FNPs and our programs have traditionally had about 100% pass rate, so not too shabby, right? And we do through this program really try to prepare you not just for passing a test, right, or your certification exam, but also to be the best practitioners out there, right? And so quality is high on our list of things to do. So you might take a first few classes and go like, this is not a nurse practitioner curriculum, but every course you take really is connected to what you need to know to be a strong nurse practitioner. And it starts with theory and ethics, and you will take a research class, and you'll take a community-oriented primary care class, and statistics. You use that in diagnostics, right? And so really understanding that every course you take is building the best nurse practitioner that we know we can put out there. So and we put the little Mason stamp on you when you leave. And we can talk about later in the program, really what are our nurse practitioners that have graduated from this program doing? And there's some really exciting stuff there. So Caroline, take it away.
Yeah, for sure. That's definitely a lot of definitely a question that I hear students ask a lot is what students do after the program. So
Mhm.
that's great.
And so, oh, here we have our curriculum. And so, Dr. O, if you'll run through this for the
Sure.
students really quickly.
Sure. Yeah, absolutely. So we start with theory and ethics and why, because it's foundational to decision making in what we do as nurses. And what I hear from students that have entered this class and exited the class, it's like, I wish I had known this before I had become a nurse, right? I didn't get a lot of that in nursing school. And so ethical dilemmas, especially through COVID, you saw that all the time, right? During COVID, were some ethical dilemmas, but they happen even outside of COVID. There's a lot of ethical issues that come up. And so having a foundation and having a method, right, to work through ethical dilemmas in that course is really good. And they will come up as a nurse practitioner as well. So we're going to change this around a little bit, right? So you'll do 665 and then you'll do, so I thought we were going to add the, okay, so we're now College of Public Health. So this is a little different. So what you'll take is 665 and then you'll take what's called foundations or the foundations of public health, right? So you'll take 665, then the public health, and then we're actually going to get rid of one of the nursing and research classes. So it will be, you'll take just 757, which will really be a focus on evidence-based practice, quality improvement, that kind of thing. You'll take so you'll go 665, 688, right? And then you'll go into your 715, 757 course, and you'll also take nursing 643 up there in those core courses, right? So those become your core master's level courses. And then you will go into what we call level 2 core, which is really your nurse practitioner courses, the foundations of your nurse practitioner courses. And you'll hear us call it the 3 Ps, but it really is 4 Ps here because we add one. So the first one will be your pharmacotherapeutics, which is different than the pharmacology class that you took as an undergrad, right? Which was all about classes of medications and, what are the nursing implications and all that. This is about prescribing, right? And how you will be a prescriber and how the selection of medications is based on evidence, right? And clinical practice guidelines and what you need to know to prescribe these medications in a safe and quality way, right? To not overprescribe, to not underprescribe, to really just give patients what they need. And so the way the course was built is it is in tandem with our physiology and pathophysiology course, and that's advanced, right? And so you'll be learning a body system. So we'll say cardiac and then cardiac meds, right? And then the different diseases, chronic diseases and conditions you'll see with cardiac. So that by the time you're done with that class, you'll know, like if it's something like pneumonia, right? If it's respiratory, then you'll know what antibiotics to prescribe for that or not, right? So just knowing the kind of the back and forth of how to manage disease, right? Then you'll go into health assessment, and we're changing that up a little bit in that it used to be 2 8-week courses. So we're going to do health assessment in tandem then with clinical decision making so that you can put it all together. So you'll do the foundations of pathopharm, right? And figure out like this disease, these meds, right? And then you'll come into health assessment and it'll be, here's how I rule in and rule out based on my exam, right? And then how would I manage that, putting it all together, right? Writing SOAP notes, doing those kind of things, and really thinking through the practice guidelines and how I would not only treat or manage, but how to diagnose, right? So that's a thing that is missing across nurse practitioner programs, physician programs, and, what do they call physician assistant programs, right? And so there's a whole society to improve diagnostic medicine right now out there, and it's a big thing. So we really push the symptom to diagnosis books, things like that, that'll really help you to not see, people don't walk in with their disease, right? You have to actually diagnose that. And so you can learn about the disease, how to treat it, and how to even do different things. But it's with your health assessment and your clinical decision making that you'll actually be able to go back, look at the symptom, right, and then be able to diagnose and then treat based on that. So that's it. And then you'll go into your family nurse practitioner courses 1, 2, and 3. And so we go and then we make a flip, right? We flip from body systems to populations. So FNP 1 is all adult, right? mostly adult acute and some chronic, right? Diseases, but you've had a lot of chronic along the way. So acute and chronic, mostly primarily adults, but not older adults, just the adult population, right? In 739, you'll move into pediatrics, so children, child from birth to all the way up, right? And you'll really need to know some adolescents and then young women. So you'll do some women's health type of stuff in that class across the spectrum. So from, teenagers that might be pregnant, right? All the way through the older adult and looking at things like breast cancer, those kind of stuff. So that would be nursing 744. As you get into that's 739, 741. These are the didactic courses. Then you'll go into elderly population. So you need to know them from, birth to not birth to palliative care and end of life. So in 741, you'll do that, and then you'll do care of vulnerable populations. And that is a big thing with nurse practitioners, is really understanding those social determinants of health and how the different, how do we approach the different vulnerable populations that can be across the lifespan. So it'll be those three. Now, with all of those, you will need to know, like, what are the diseases that primarily affect adults, that primarily affect children, women of childbearing age, and that kind of thing. You kind of need to know. And that's why the population helps you narrow that differential, really get very good at diagnostic and management of disease, right? Of chronic and acute disease. So that's kind of your courses. So it does seem like there's a lot of like core at first, and you're like, I just want to, get to the real stuff, right? But these are really important, and they should drive your decision making, and they should drive data informs, right, practice, and then understanding the systems of care within our, especially in the United States, and what are the different systems of care, but also with public health, understanding primary, secondary, tertiary type of approaches to health, right? So that's what you'll do in those courses, and I think you'll be really happy with all of the courses. And we are kind of updating some of them so that you're even more happy, right? So it's really a fun way to learn. And most of us, I think all at this point, right, Caroline, we do weekly sessions. So even though it's an online course, we will be available at least once a week, and then also for office hours, right, remotely, so that you guys, if you have questions, if you want to jump on and listen to the faculty kind of review the week or have questions for the week, you can always jump on a Zoom session during the week, and we record all of those so that you have that. Okay. And I think that's it. Career outcomes. I would love to hear from you guys to see, like, why do you want to be a nurse practitioner, right? But most of our students end up in a primary care, but there's many in community health centers, and actually in health departments, right? Home health organizations, urgent cares, hospital, and there's plenty of FNPs that actually do work in hospitals. FNP is the only one that doesn't prescribe acute or primary, right? So if you were an AGNP, it would say you have to decide, right? Acute care or primary care. If you were a pediatric nurse practitioner, acute care or primary care. So they're different curriculums. The FNP doesn't really prescribe that. But you should look at the LACE model and look at those, like, what is the things that you would expect an FNP to do? And I will tell you, there are some hospitals that are starting to say that FNPs can't work there, but most of them are going like, actually, they really can. So it is an interesting approach. At Mason, we also run medication-assisted treatment programs. So if you're close by, you can certainly join us in person if you want to come and do that, or we have telehealth visits as well. So all of you, when you're in your practicum courses, will come and visit with a nurse practitioner faculty in our Mason and Partners clinics, either locally, come on in, or by Zoom. So it'll a Zoom telehealth visit. It is our way of making sure that you are approaching the patient the right way, that you're asking the right questions, and you're narrowing that differential. There is a variability in salary for sure for nurse practitioners. Starting, I don't think it's quite 120. It was for a while there. It's kind of like fluctuating a little bit right now, but that's something we'll show you how to do. And Carolyn, Dr. Stowe actually is really good about, like, how do you negotiate that contract, and career service is actually really good about that too. But we will go over that with you, because there's more than just your salary, right? When it comes to a nurse practitioner contract. So keeping that in mind, that is actually a focus of what we go over in that FNP3 course as well, to really make sure that you're ready for practice, right? And that you are your own advocate for salary, CE money, that kind of thing, your licenses, your insurances, all of that kind of stuff is really important to negotiate when you're doing that. And malpractice for sure. So we do have one nurse practitioner that's working at a that I'm really excited for her. She's just doing great work and working with the sickle cell population in Southwest Virginia. And so she's like the regional leader for that. So there are some really cool jobs that can come out of this. One of my nurse practitioners started a whole wellness thing with the fire department in Alexandria. Like, it really is an opportunity to be an entrepreneur as well, and think about how you might develop your own business. Nurse practitioners are just really needed, and primary care really is where we need them. But if that doesn't turn you on, there's plenty of places that, and certainly community health centers. So we do like to expose all of our students to care of vulnerable populations, because it is a huge need in this country. And we offer services, from chronic disease management, acute care, school physicals, that kind of thing, and psychiatric mental health with our nurse practitioners. So it's really the future is bright. And we do there are a lot of people that are getting an FNP and also a psych mental health nurse practitioner certificate along with that, and we do offer that here. So that's something to look into as well if you like that kind of psych thing a little bit, right? Okay, next slide. Anything else you want to add, Dr. Stowe?
No, I think it's just, y'all, I've been a nurse practitioner for 13 years and have been in nursing for far longer than that. And I started off, I graduated with my FNP and went straight into a community health center, a federally qualified health center. And it was sort of like the best base for me. But for what I do now, it's very different, right? I mean, I kind of created this niche spot for me. I actually work in headache medicine. I also work with PrEP in HIV patients. So you can do so much. You don't have to just do one job. And I think we all get excited to get to do different kinds of roles, but you can work in person. You can do telemedicine, after you've been practicing for a little while in brick and mortar. It's just so exciting. It's my favorite topic. I'm like, what do you want to do? What's exciting to you? Right? Because that is what's going to keep you from burning out. And that's what's going to keep you here, in nursing and caring for people. So I can't wait. This is my favorite topic to talk about. How can we get you the best contract? And then how do we keep you excited about caring for people? Sometimes it takes a little bit of time, right? To find that spot, but I promise you will, right? So I love, and this is something that Mason does such a good job about, bringing in voices from the field, bringing in different perspectives, because I remember being in my master's program and speaking to a nurse practitioner who did derm, which wasn't really my thing, but she was so excited. And she was like, I work 2 days a week and make all kinds of money. And I was like, well, that's fabulous for you. But it was just, I just didn't know. There was so much I didn't know. And there's still so much I learned today. And staying in touch with your faculty, which is what we do here at Mason, really helps set you up for jobs and helps set you up for really, really great jobs. So
I continue to get text messages from the students that have graduated. It's really fun. And so make that connection. It's really important. Is this us?
Yeah, this is how you
No,
do
this
it.
is me. Sorry, I didn't realize I was unmuted. But again, my name is Casey. So I'm an admissions advisor here at George Mason. So pretty much what my role is, I will help students throughout the process to applying for master's programs, specifically MSN. So pretty much you'll talk to me. Like I said, I'll be your advisor, helping you throughout the application process, making sure, everything looks great on your application, so that, you have the best application to get into the program. Again, I'll help you make sure that you're, uploading your resume. They like to see recommendations, academic, professional, things like that, as well as a personal statement. And we also do help with requesting transcripts as well. Another great thing here at George Mason. I know sometimes those little fees here and there can get a little costly. So George Mason does actually help request your official transcripts from your bachelor's. But there sometimes is a little bit of pushback from some universities, but it is a little bit of perk that we have as well. And those are the other things that we request. The prerequisites, must have a BSN, with a minimum of 3.0 GPA, active US RN license, 1 year of experience as an RN, and a current CPR card as well.
Yeah. Can I jump in here just for a second? So sometimes things happen, right, when you're getting your BSN. And if you have like a 2.9, right, but you have like this happened, like just write a little statement about, this is what happened during my BSN, and this is why I had a 2.9, 2.8, because we still look at them, right? And really, if you're working for 5 years and you've got a good track record and working and all that kind of stuff, we actually don't. We don't hold, like, we'd like a 3.0, but that we understand that, sometimes it just doesn't happen, but doesn't mean that you're not a great nurse or a good student. So keep that in mind if you're close to that, right? Mm-hmm.
Yeah, thank you. That's also one of the questions I was going to have at the end. But thank you for answering that, just because that's definitely a common thing that students come to, and they worry about, their GPA, but they have such great work experience, like you mentioned. Alrighty, anyone have any questions? I'm gonna see, utilize the question and answer function as well. And let me know if you guys have any questions for the professors. Thank you guys again as well for taking the time to do this for us as well.
It looks like we have 8
Yeah.
in here now, so that's cool.
Yeah. Oh, wow. Awesome. Can't really. Oh, there you go. I see now where I am.
Mm-hmm.
So someone asked, what is the average class size?
So actually, our new, what's called the National Task Force for Nurse Practitioner Programs has a new quota, right? So clinical would not be more than 1 to 8 per faculty. So one faculty to 8 students for clinical, and courses are, you can go upwards of 1 to 30, but ours, I'm keeping it at like 24 for the most part. There might be 25, there might be whatever, but that allows for a really nice size course where you get a lot of attention. And to me, feedback, a timely feedback is really important to me in those courses. And so this allows the faculty teaching these courses a little bit of time. And if I didn't mention, I'm actually the interim director for the School of Nursing right now. So I have to oversee a lot of programs, but I did help to build this program. And I think it's really pretty top notch. And we have some really strong faculty teaching in it. So I think you'll really enjoy it.
Thanks for the question.
I see other questions, but
I also wanted to say, we take what you as students say and your feedback really seriously, right? So you get to do mid-semester evaluations, you get to do end of semester, and when we meet weekly, I've had students that say, Dr. Stowe, this is like, our group's too big, this is too complicated, this is too much. And we take it into consideration and say, all right, let's make some changes. And how can we really make this work well for you? Because our goal is for this to be, for you to be successful and for you to enjoy it. And so please know that that certainly is important to us. And we take it very seriously, and we love all the good feedback, and we thrive off of the stuff that gives us some good information to make some updates. So.
We got another question. What is the process for clinical placement?
Oh, it's a process for sure. So it depends on where you live, right? And so there are certain states that have rules, right? And so we have to follow the rules of the state where you live. So some are pretty easy, and others we have paperwork to do, right, for you to do your clinicals there. We ask that the students take a shot at finding a clinical site, right, for the most part, especially if they're not in Virginia, right? Because we don't know all those clinical spots, but we certainly have people that can help with that, even outside of Virginia. So take a shot at that. But it is our responsibility as a school of nursing that is CCNE accredited to assist you with the process at a minimum, right? So you will never not graduate because you couldn't find a clinical site, right? It would be our responsibility to help you to find that clinical site. And we've done that before. And we've done that in Oregon, and we've done that in other places where we just, it was kind of a phone a friend thing, right? Because we all, like, nurses are a big, we know each other, right? And nurse practitioners even more. So you go across the state and you find some friends that, like, I know a person in Oregon, I know a person in California, that kind of thing. We are approved to have students in California. We're approved in Alaska. We're approved in a lot of different places where it's often difficult because we're such a good program like that. Like we filled out, we did everything we're supposed to do to demonstrate that we're a high quality program. And I'm telling you, there is a lot of legislation getting ready to pass that says something differently for these programs that are, you know, these online programs that are like kind of fly by night. They're really just there to make money. That's not who we are. We are a very reputable R1 institution in Virginia that the quality of our education is really important. So, and the clinical is so important to that, right? So we want to make sure that not only you have a really good clinical placement, so we'll check out your preceptor. We definitely need a CV from the preceptor. We'll call the site to make sure everything is good. You know, what resources do you have? What orientation you have for the student? And then we'll orient the preceptors. We make sure that we have a practice agreement or a contract, we call it, but it really is a practice agreement with the clinical site. So all of that can take a couple of weeks to get done. So the earlier, you know, you get that in. Our faculty will talk about clinical a couple times during your program, right? Just to make sure that you're ready to go and that we don't, the big thing is don't wait till the last minute, right? Excuse me. So, but Caroline, Dr. Stowe is really on top of all that. We've got others that help specifically with clinical placements. Just, you know, it really is just we really are a partnership with you, right? To help you meet your goals. So it is sometimes a back and forth, making sure that, you know, that we can make sure you get all the hours that are required. And so there is this thing with hours right now, right? So the new document wants 750. We do 600 right now, but we haven't actually added that to our program yet. So if you're coming in the fall, you're still at 600, but we may change that as this new document gets implemented more and more. So CCNE has not accepted this new or approved this new document from NTF or our AAC and Essentials. So it is going to be probably next year before that's all approved. And then we are going to have to get the 750, which is actually what it was when I was in my FNP program. I had to have 750 hours. So, you know, it'll be interesting to see what happens. NOF, which is the National Organization of Nurse Practitioner Faculty, they actually would like students to get 1,000 practice hours, but they also want them to get their DMP. So there's a lot of like changes on the horizon coming, but you know, the ANCC, that is the certification, right, for your NP, still only requires 500. So there's a lot of numbers out there, right? And so which is the right one? Is the right one for you is actually the one where you feel confident, right? So it's not about 500, 600, 750, or 1,000. You need to feel confident leaving here that you have at least the foundational knowledge, just like you did when you became a registered nurse, to go out and practice as a nurse practitioner. So I'm telling you, like, we have students that sometimes it takes 700 hours, right, to get them to where we feel comfortable and they feel comfortable, you know, graduating and doing that. But for the most part, it's 600 hours for our nurse practitioners with a master's. Yep. Makes sense?
Yeah. And I was just going to say too, and that's where that really quality site comes from, right? So we have some students that say, oh, I have a site and they're great. And it ends up being something that's not appropriate for the program, right? There, it's really much, we do allow some specialty hours, but your base, your core really needs to be in what Dr. O talked about, the family medicine, peds, adult, that kind of a thing, chronic care, acute management. And so, you know, if it's not the right site for you for what we need, we'll help you. You know, we have a clinical site advocacy component that's really strong, and we will become best friends along the way because we'll talk so much and we just want to get you through. And so if for some reason the site that you want to go to doesn't work for the 600 hours or, you know, or the 500 or whatever, we can certainly work some things out. But what's so important and what makes this program so different is that we really do vet these sites, and they have to be where we know you're really going to learn, because that preceptor is so important. Your clinical faculty is so important. Our clinical faculty, I mean, we have all kinds of text, WhatsApp groups, all kinds of things. I mean, they're getting pictures of my kids all the time, whether they want it or not, right? But I mean, they're like family to me. So I am so proud of the NPs that we have produced. And every time someone texts me and says I passed my boards, I think, well, I knew you would, right? And so just know that we'll work with you, but it is something that you want to start a semester or two. If you want to come into the program and you have sites, we'd love to hear about them, and we can't wait to get you all signed up for it.
It's so true. And there was a question about, what if you struggled before and you struggled in high school, you struggled through the BSN program. I would say, one, we're here to support you. And so if it takes us getting on the phone with you every day, or, getting on a Zoom session, walking you through these processes, we'll do that. Right. And also we actually encourage study groups. And literally it's such an important part of graduate education is to really have a friend, right? Or a group that studies together, that whatever. And you can study on Zoom now, right? Very easily. If you're close by, certainly come to campus. We have a beautiful lab that you can come in and do things. We're looking at some programs that help with some remediation stuff a little bit, help to further explain things. But there's a vast amount of resources, either through Mason Library, through lots of different avenues that we provide to you guys. You'll have access at some point to up to date, to different types of resources, all the Bates videos for your health assessment, all of the Access Medicine stuff through our library, which is easily downloadable, Dynamed, all kinds of stuff that will help you to get there. And we're looking at a product called Osmosis. I'm just not 100% sure yet, which is really a nice way to, it's actually a different way of learning, right? And so it's a lot of I call them whiteboard talks, and really nice resources that are, I'll call them Gen Z, really strong resources for Gen Zers, right? Because there isn't 14,000 chapters of reading, right? It's almost like a, let's get to the high points kind of learning a platform, which is really good. We're also into the AI, and really in the Chat GPT, and we're trying to integrate that into some of our courses, because you know what, if you're not going to beat them, right? So you got to join them. And how can we use that in practice or in our scholarship in a way that is helpful? So
yeah, I think that's a good point. Also, I'll say this, my BSN program, which was, I'm not going to tell you when I finished that one, but was so different than my master's program. Okay. It is just, it feels different. I had so much stress. I mean, I was so stressed out in my BSN program. It felt different. When I got to my master's, I was like, oh, they're treating me like an adult. I love it. And we treat you like adults. Your master's level students, we do expect master's level, sort of deliverables, but you are an adult. We are a team, right? We certainly do not act like we are anywhere above. We're just trying to just provide knowledge. So I will tell you, I remember this. My BSN program was very stressful for me. It was hard. It was so hard. And I'm not saying this isn't hard, because it is, but it's different, right? It's exactly what you want to do for the rest of your life. So no, don't worry about that. We're here for you. Just know that this program is different. Your master's is different than your BSN.
It totally is. Yeah. And quite frankly, it is some self-learning, right? Because you have to find the resources that work for you at times too. But we're here to facilitate that learning, right? We're not going to just let you out there hanging. And so, you'll see faculty in the course, even though they're online, you'll see a presence in there. I was going to say something else, but it just left me. But oh, I know what I was going to say. So with every credit you take, plan on it 3 hours, right? A week of studying. So it could be upwards of, if you're taking 6 credits, 18 hours a week, right? It depends on the course, but it is an expectation that you'll be spending that kind of time on these courses. And I don't mean that to scare you away, but to do a calendar of when you can't wait and study all on Friday night, right? Because there's not enough time, but piecemeal your calendar so that you find that time, not just to study, but also to practice some self-care in between all the working that you're doing, and know that you got to find that time and that balance in your life, right? And it's okay to say, I'm going through something right now, right? I don't know if I can get it in this week. Do you mind if I have an extension? That's okay, right? Yep. So know that that's always okay.
Yeah, just know that when it comes to when you start clinical, which is y'all like right at the end of your program, right? Like you're ready to go. There are a certain number of hours you need to make for that semester. So if you're already working full time, plus picking up extra shifts, plus you just had a baby, plus you got a new puppy, don't get a new puppy and have a new baby at the same time. I'm just giving you a warning. You know, we need you to make those hours because it is a requirement, right? So if you come in and think, oh, I don't even know if I can make it, just look at how you might be able to shift some things around. I've had people, I'm like, you're taking your 40 hours of PTO now and you got to get your hours in, you know, so we'll work with you. Absolutely. But take a good look at this and make sure this is something that you can, you know, you can fit in, because at the end, it is just about finishing those hours. Right. So.
Awesome. Thanks.
So it looks like Madison is asking about if there's a bridge to the DMP program. Absolutely. We do there are some courses in the DMP. We do want people on campus, but we're really looking at that as a continuation for this MSN program, and trying to see how we can do maybe some more online. And you know, I don't know if you were looking at that from a you want it online, Madison, or if you want it more like just continuing on in this program, or if you would mind coming to campus, because there are some DMP things that executive format, so some immersion experiences on campus are kind of important for your learning. And you know, through COVID, we did a lot of DMP online, and it just didn't feel the same, right? So that's what I will say to you. But yes, absolutely, we have a master's to DMP program. And I'm actually working on looking at a way to bridge and actually give you more credits as you continue on in this program. So for sure.
The next question is, do you still have in-person FNP program? If you do, what is the difference with the online curriculum, and what is the schedule like for in-person?
Yeah, it's a hybrid. So it's some in class and some online, right? But for the most part, it's the same curriculum. So because that's what's approved, right, through our programs. So you would take the same courses as a person that is in the online program. It would be that you're just on campus for some of your NP courses, some of your health assessments, some of your mostly at the end of the program. So the core curriculum we talked about is online, and then we go into more of a hybrid type of model.
Next question is, how many years is the program?
It's 2.5 years. So it's 49 credits, right? So that's usually about 2.5 years if I think I did it right. Yeah.
Yep. And then, oh yeah, so Caroline
Yeah,
just
same
answered.
kind of an idea, right? That is that if you continue and you take all the courses as you should, and we have success coaches that help set you up to know exactly what you're going to take which semester, and walks you through that whole process. But of course, if you have extenuating circumstances, you need to move, you have a baby, you get a new pet, right? I have a lot of pets. Anything that you need to delay, that's totally fine. Just stay in touch. Communication, y'all know this, right? So important. If you all of a sudden go MIA, I'm having to come knock down your door to find you, then I'm going to worry. But all you have to do is just stay in touch, and we're happy. Of course, if you need to take a semester, you know, take it. We don't want you getting stressed out and being in school when there are other things happening. We want this to be a fun, successful program for you.
Yeah, for sure.
Yeah, and Holly, we actually did. We've done this already, right? So we had someone living, I think, in Australia, and so she waited until the end of the program and did all her clinicals, took a semester off here or there. We've had so many things where people just needed some time off, especially through COVID, right? Think about that. And so, yes, we absolutely can. Every course is taught every semester, including summer, right? So every course is repeated. So you could fall back on one or take just one in that semester instead of the two, and be able to kind of pick up. Some students come in with credit, so theirs might look a little different too, but absolutely. And if you kind of want to do the front loading part of things and then do the clinical at the end, you can do that as well.
And then the next question is, every class is 8 weeks with one class at a time, with 1 weekend off in between courses.
So the schedule's changed a little bit, but I think that's about right.
Yeah.
But we're trying to make it so that our so it used to be like our Mason online program, like right after the holidays, you were there on like January 5th. And so now you have a little bit more time. So there's actually a little bit of a break at the winter break, right? More than just a weekend. And I believe there's a little bit in the summer as well, right before classes start. So it's a little bit more than what it used to be, but yes. Because that's not only draining for the students, it's draining for the faculty too. So it is, it's nice to have a little break in between those classes starting up for sure. Mhm.
Alrighty, I think that's all the questions. Any other ones left? We're just getting to the time.
And I did send a private message to one of them and
Yeah,
that they can just call me. Yeah.
I was gonna say, y'all, and let me make sure I put my email. I don't know if I have my email on these slides, but this is my email. Feel free to directly message me. I'm always happy to answer questions, and I love this program. I love George Mason. I mean, it's just, I can't tell you what an incredible experience I've had as a student and as faculty. And you're getting the best of the best with Dr. O, honestly. So send me all the questions. I love talking about it. I love answering all of them. And if, I don't have the answer, then Dr. O always will. So I'll get back with you quickly.
And I'm actually now a professor, not an associate professor. So that was a nice little thing that happened this year.
Yes.
But happy to help in any way too. So Dr. Stowe, myself, Dr. O, not Dr. Ajan, is always what I prefer. And really, we're here. So any questions, just let us know. But it's been great to have you guys here tonight.
Yeah, thank you guys so much for taking the time out of your day. We really do appreciate it. I know students appreciate it as well. I know there's some that couldn't make it and we'll watch this, recorded version as well. So thank you. And I'm also going to drop some other contact information for students to have. Please feel free to contact us at the main line when you want to start an application, and you'll talk to myself or one of my colleagues as well to start your application. But thank you everyone for joining. Thank you, Dr.